Most pets vomit at some point. Sometimes it's something simple, like eating too fast or a mild stomach upset. But sometimes vomiting can be one of the earliest signs of an underlying medical problem. So, how do veterinarians tell the difference? I'm Dr. K, and this is Inside Pet Medicine. On this channel, I help pet owners understand symptoms, lab work, and chronic disease in a way that actually makes sense. One important thing to understand is that vomiting itself isn't a diagnosis, it's a symptom. The challenge is figuring out what's causing it. Not every vomiting episode is an emergency. Many pets experience occasional vomiting from eating something unusual or from temporary stomach irritation. Veterinarians become more concerned when vomiting is persistent or occurs alongside other symptoms. So, what kinds of conditions can actually cause vomiting? Let's walk through a few of the more common possibilities veterinarians think about when evaluating a dog or cat that's vomiting. This isn't a complete list, but it will help show why the same symptom can have many different causes. One common cause of vomiting in older dogs and cats is chronic kidney disease. When the kidneys aren't filtering waste products efficiently, those waste products begin accumulating in the bloodstream. That buildup can make pets feel nauseated, which often leads to decreased appetite and vomiting. This is one reason vomiting and appetite changes often occur together in pets with kidney disease. The liver performs hundreds of important jobs within the body. When liver function becomes impaired, pets may begin feeling unwell long before owners notice obvious symptoms. Nausea, decreased appetite, and vomiting can all occur with certain types of liver disease. That's why vomiting isn't always a stomach problem. It can sometimes be a clue to diseases elsewhere in the body. Pancreatitis means inflammation of the pancreas. This condition can cause significant nausea and abdominal discomfort, making vomiting one of the most common symptoms owners notice. Some pets also become lethargic, stop eating, or appear painful. Pancreatitis is one of the more common medical causes of vomiting veterinarians investigate. Sometimes the vomiting is coming directly from the digestive tract. Food sensitivities, inflammatory bowel disease, infections, and even foreign objects within the GI tract can all cause irritation within the stomach or intestines. These cases often require additional testing because several different conditions can look very similar from the outside. Veterinarians don't just ask whether a pet vomited. We ask how often, for how long, what other symptoms are present, and what the lab work shows. The next steps depend on the pet's age, symptoms, exam findings, and medical history. The biggest takeaway is that vomiting is just one piece of information. Veterinarians combine symptoms, history, examination findings, and diagnostic testing to try to understand the full story. Have a question about vomiting, lab work, or chronic disease? Leave it below. Subscribe for simple Vet Explained Pet Health.